Whoops. Okay. So let's adjust our cameras. Okay, everybody's good. Nothing in the background. All right, so today we're going to move on to the new section of the evidence-based portion of the webinar. So today we're going to talk about obstetric evidence. So obstetrics is basically about pregnancy and delivering and everything in between. So last we left off, unfortunately, is with frequent miscarriage, which we can treat. It's very helpful with acupuncture. But once the patient is pregnant, there's a lot of things that we can do. And initially, the beginning is nausea, discomfort, right? The first thing is morning sickness. So there's really a large body of evidence for acupuncture and efficacy that is with nausea due to morning sickness and also due to chemotherapy. But specifically, we're going to talk about nausea due to pregnancy, morning sickness. Also, we treat breech presentation. That's when the baby hasn't flipped yet, it's head up instead of head down. We can also treat depression during pregnancy. We're not really going to address that today. Inducing labor, which is really big, and that's so much, so rewarding. Now, I don't really see it because I lose the patient, but the feedback is very positive afterwards when I reach out to them. Promoting lactation and sufficient lactation. Again, we're not going to talk about that today, but also general discomfort with pregnancy. You know, what do you do when you're in pain, when you have sciatica, when you have carpal tunnel syndrome, you have these difficulties as your body's changing and expanding. You can't take pain meds, you can't take drugs. It's harmful to the fetus. So, you know, what are your options? You want a very sort of like non-invasive, mild, non-pharmaceutical medical intervention, which is acupuncture. So the first thing we're going to discuss is breech presentation and malposition in the fetus. So studies evaluating acupuncture in case of breech presentation indicate the method to be effective. Okay, so they find that it is effective. Acupuncture should be attempted in cases of breech presentation. Why? Because there is no negative effect to it, right? What's the harm? And it's not really that, aggressive, because really all it is, it requires 2 points on the toe, the outer corner of the pinky toenail. We put a couple of needles there. We kind of tweak them a little bit. The whole point is to get the baby to move down. So as you know, acupuncture releases endorphins, and those endorphins are absorbed by the baby because it goes into the bloodstream and the amniotic fluid. But at the same time, it's not the most comfortable sensation. So as we agitate the mother a little bit, the baby starts to move, but because it's absorbed the endorphins, it's not flipping wildly all over the place, and we kind of coax the baby. A lot of the studies that were done showed that fetal heart rate goes down, the fetal activity goes up. So basically what we're doing is we're kind of getting the baby calmly to move, and that's how it works with breech presentation. Inducing labor. Now, I know I've induced multiple patients, and because, you know, it's a big event, right? You have a baby, your life changes, you're very busy. You're not going to call your acupuncturist right away and tell them, hey, everything went well. But, you know, with follow-up in patient interaction, I've reached out to some patients to find out what happened. Now, a lot of times patients do go. Now, let me just be clear right now. The biggest problem is patients call me out of blue on the 40 weeks, the day of 40 weeks, the day they're going to be induced. Yes, you can go. The baby's going to come when it's going to come, but sometimes we want to work ahead of time. So 37.5 weeks is really a good time to start inducing labor very mildly. No doctor, no obstetrician is going to allow their patient to go past 40. It's dangerous for the baby and the mother. So I don't blame them. They want to do that. But please, please, please don't come to me at 40 weeks and say, I need you to get this baby out, because it doesn't necessarily always work that way. Sometimes it does. Sometimes we need a little bit of work. So think about 37 weeks, 37.5 to just gently, mildly. And why does it work? Because induction of labor and prolonged pregnancy, acupuncture is comparable to oxytocin. Acupuncture stimulates mother's body to prepare for labor. Prostaglandins are released to soften and ripen the cervix for labor, and oxytocin to trigger contractions. The process is natural. The mother and the child will experience a gradual, less traumatic onset. So that's a big deal, right? And that's just word for word from the study. Basically, what happens is, as we treat, we basically get the cervix to dilate and get, bigger and bigger and bigger, so that eventually, when you get to the point, all right. So worst case scenario, say we do our procedure and we don't induce immediately. They're going to do oxytocin. They're going to, they're going to put the pitocin in, and they're going to stimulate to induce labor. But because the cervix is already soft and has grown in diameter, the baby's ready to come out. So it's much more easier on the mother and the baby. And this is just secondhand feedback. So I'll get patient. I'll call them. Hey, how did it go? Oh, I had to be induced because they come to me on day 40, and it's really doesn't always work right away. But the feedback is the labor is way easier than being induced before. In comparison to being induced before, it's like night and day. It's so much easier. The cervix is open already. The baby's ready to come out, and it's much more pleasant experience for the mother and the baby, right? Because they're both going through it. So that's inducing labor. 37 weeks, 37 and a half weeks. Let's get started, nice and easy, and then things will go easier for you. So, discomfort during pregnancy. What does that mean? It means a lot of things, okay? Acupuncture research with evidence suggesting a benefit from acupuncture to treat nausea in pregnancy, effectiveness of acupuncture to manage back, pelvic pain, and pain relief in labor. So, yes, that's good. Back pain. I see a lot of sciatica, okay? So as the bones soften and the hips spread in order to, get the baby out, they start to move and ligaments move and they spread and they put pressure on the sciatic nerve. I know my wife had double sciatica with the last baby, but women do get sciatica pretty bad because like I said, the hips are spreading and the baby's ready to come out. So things start to move and they press on weird things. The other thing I see too, because the bones are spreading, there is a slackening and a softening in the wrist. So carpal tunnel syndrome, something that's very common, or wrist pain. So that's two things that we can definitely correlate and say is helpful for discomfort. Nausea, like I said, there's a large body of evidence for patients who have morning sickness to say that it does help in the early stages. Plus also, one of the things, if you're treating frequent miscarriage, right, with a patient, we know that the first trimester is critical. So we do have a first trimester protocol. So if you're coming from a history of frequent miscarriages, it's not a bad idea to kind of help the pregnancy move along and make it easier for you. But that's just something that's available for our patients. The other thing that I've seen, which is often not a textbook cases, is if you have a patient who's smaller frame and more petite, and they're carrying a larger baby, they start to run out of real estate very quickly. And I get like a lot of patients who tell me they have this sort of like rib pain. And it seems like, oh, the baby's foot is over there, the baby's head is over there, it's pressing. But no, the baby has kind of spread out into the abdomen and pushed into the rib cage. So it's very hard for the mother to get relief from that. But it is, again, it's not going to get better until the baby comes out, right? But we can get control over the pain signal and block it so that at least the rest of the pregnancy is more comfortable. And I've seen this multiple times. So discomfort is pretty general. You don't want to take medication. There are harmful side effects to antiemetic drugs that they prefer not to use. But your doctor, if they're, responsible, the obstetric doctor will not want to give you pharmaceuticals if you're not on them. So what's your next best choice? Obviously, acupuncture. We're not going to do herbs. They don't do herbs during pregnancy. A lot of them are contraindicated, but we can do a lot with just acupuncture alone. So you don't have to suffer. It doesn't have to be a long, arduous pregnancy. We can make it more comfortable. And frankly, as a new mom, you get to play the new mom card. Self-care is not selfish. Come on in. Also, as the body changes and progesterone is released, sometimes you have a little, anxiety. We can treat that. You don't have to go on pharmaceuticals for stuff like that. But always know, we're here to help. It's always available. This concludes the evidence portion of the obstetrics, and then we're going to go into some case histories where we'll talk about, patient by patient through the years that I've treated that had some sort of specific and significant impact on, treatment, and how we can take and leverage that experience to present it to the viewer to see how it can help you. So with that being said, I thank you, and we'll tune in maybe tomorrow evening. We'll talk about it and finish it all up, okay? Thank you.